Let's talk about feline asthma symptoms. Feline asthma essentially is an allergic type of reaction to something in the environment or food, and that allergic reaction is occurring in the lungs. What happens is there's fluid development, histamine release, and there's bronchospasm, and those are the little airways. And so these cats can go from being normal to having a very difficult time breathing very quickly. And so it's considered an emergency. If you think your cat is breathing heavy for any reason, get them to your veterinary clinic or emergency clinic. What happens is when they are reacting, when these cats are having their asthmatic attack, they are developing little donuts of fluid in their airways. And so when this occurs, again, they have a very difficult time breathing. Fortunately, most cats are responsive to medications. Those medications typically revolve around using an anti-inflammatory like a steroid and using a bronchodilator. And so we do this together to open up the airways and decrease the reactivity and decrease the inflammation. Human inhalers like albuterol inhalers or things have been used in cats as well. You always have to check with your veterinary clinic to see if that's the appropriate therapy or what is the appropriate therapy. Cats with asthma are typically lifelong, and so you always want to eliminate anything, candles, incense, things from your environment to help these guys out. These cats typically, the most common symptoms are going to be breathing hard, open mouth breathing sometimes, vomiting, coughing, lack of appetite, laying around and being withdrawn. Those are the most common symptoms. You can see them really use their abdominal muscles to breathe, and that could be a sign of asthma. If you think that's going on, let your cat get checked out by your veterinary clinic.